I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're joined in the studio by State Senate Health Committee Chair Gustavo Rivera, a Bronx Democrat. Welcome back to the show, Senator.
Pleasure to be here, sir.
So, as a result of changes pushed by the GOP-led Congress in 2025, the Hochul administration was forced to revamp a state-run health insurance program for low-income New Yorkers who make too much to qualify for Medicaid. The state recently got approval for a transition plan that will ensure about 1.3 million New Yorkers will keep their coverage, but that leaves more than 400,000 enrollees left behind unless an alternative coverage option can be approved. You're looking to continue coverage for those New Yorkers making between 200 and 250% of the federal poverty level, as well as cover those New Yorkers ineligible because of their immigration status. Why is that the approach as opposed to having these people try to find coverage in either the open market or through the state's health insurance marketplace?
Well, first of all, it's because it's going to cost them much more than they would be paying if we continue the coverage. But let's
because they get free premiums right now.
Exactly. In some instances, yes. So, first of all, the bad news is that we have 450,000 folks who, as you said, July 1st will lose coverage. The worst news is that come January, 200,000 more, because of the changes in work requirements, will then lose coverage as well. And between now and the end of next calendar year, so between now and the December of 27, you have about 1.2 million New Yorkers that will have potentially lose their coverage, right? And this is what's important to understand. These are individuals who are not going to go away. They're not leaving New York State. They're not disappearing. They're going to be here. The health ecosystem is one. We all in the same one. So if you have all of a sudden up to 1.2 million people who are uninsured, then you have that still in the system. They still rely on emergency rooms. They still rely on nursing homes and other facilities. The pressure that's going to put is immense. So it's something that we should be doing to actually address that. And so the bad news is that we're going to get these 450,000. The worst news, 200,000 more in January. The good news is this bill that we're talking about today would actually change state law to extend coverage to these folks, to the 450,000 that we're talking about between now and the end of the year. That's an important piece. And the best news is that the governor had already appropriated $2.4 billion that she put into the budget just in case the waiver that we were seeking from the federal government was not approved. It was approved. Therefore, that money is currently sitting there with nothing attached to it as far as a use for it. So if so $2.4 billion is available to us. And on the low end, we're talking somewhere in the neighborhood of $400 million that it was cost us between now and the end of this year for those 450,000. So I think we should absolutely do it.
And that money, though, is going to be targeted by every single constituency that wants to get something funded in the near future. But do you feel like because this is a healthcare-related expense, because it is even directly part of the essential plan unwinding, that it makes sense to go to this cause as opposed to the plethora of other things that your colleagues might identify?
Well, it is a $2.4 billion was specifically identified for the purposes of covering us in case the feds didn't actually extend the waiver as they did. So that was the purpose of the money to begin with. So it's 2.4 of it. So we can have between 400. Now the thing is that the estimate is about, I think it's $406 million at the low end. I say at the low end because it depends how many people, once we create the eligibility parameters, then more people can sign up. But we know that not 100% of the people that are eligible for any program sign up. It doesn't work like that. Not everybody who's eligible will sign up. If everybody did, it would be up to about $2.3 billion for the year. But that's at the very high end. So we're talking about something that is $400 some odd million. And think about this. This is the important piece. Again, these individuals are already part of our state. They're already our neighbors. They're already across all the entire state in every district, every party, every demographic. Well, not every demographic, obviously, because we're talking about folks who are on the poor and working class folks that are at the lower end of the economic ladder, but they're all over the state. So the impact that not having any coverage for these individuals is going to have would be larger, much larger, than us not actually taking the money, which we already have appropriated in the budget. Let's take a chunk of it and then make sure that we put it to this.
Coming back to that initial question, though, are you envisioning this being a no-cost premium setup, or would you want the people who would be part of this to have to pay for some of their premiums?
That could be part of the conversation. There could be some cost offsets that we can figure that we should have a discussion about. And I'm certainly open to that as well. What I'm not open to is not acknowledging that within the budget cycle that we're negotiating for right now, between April and April, that there will be all these hundreds of thousands of New Yorkers that if we do nothing, will have no coverage whatsoever.
But what about the marketplace? Because tax credits could cover potentially up to 80% of the cost of certain plans. So you're only paying out of pocket for 20%. And granted, we're talking thousands of dollars for people who are making just a few bucks more than would make them eligible for Medicaid. So it's not nothing. But why not go that route the way a lot of other states do in terms of their coverage for that threshold of people?
Because we're not another state. Because we're us. And because these are folks who are we're already covering them. We've already have done some of the changes that we have sought from federal government over the last couple of years, right, have been specifically about expanding coverage and making sure that we cover as many folks as possible. The battles that we've had over the last couple of years have always been about expanding more how many folks we cover and how we cover them. So I would say let's keep going in that direction. And at the very least, there's something else. I have always said there's no way that we can cover everything that the feds are going to take from us. There's just no way. However, I've always said we need more revenue so that we can make some decisions about the folks that are most vulnerable. And I believe that these folks, there's a good chunk of them, 450,000 of them, who would be out in the wilderness. Now, certainly some of them might be able to go into the marketplace and afford something there, but I don't know how many of them would be. And ultimately, let's actually continue. We have the funding. Let's actually pass this bill. And if the governor wants to take this language and put it right into the budget language, I got no problem. I don't even need credit. I just need the thing to actually happen. And I mean that. What I care about is making sure that hundreds of thousands of New Yorkers who, if we do nothing, will find themselves with no coverage whatsoever in July. We need to do something now for that. By the way, these folks get something in the mail by tomorrow, by the 1st, that tells them, hey, you're going to have to seek another option within the next 3 months. So there are people who are already getting a letter in the mail that's saying you're going to have no coverage starting in July 1st. So we should move on this immediately.
So you brought up the funds that could theoretically be available that the governor had identified in case the plan for unwinding the essential plan wasn't approved. But what about the years after that? Because as you pointed out, this is a growing population that's going to be shut out of the essential plan, or whatever it's going to be called in the future, the basic plan. So do we need to do something to address the costs of this program? Because it has been expanding in recent years in light of the federal dollars that were available. We were taking advantage of all of the money that was available without maybe thinking about the long-term stability of this sort of structure. So do we need to do anything to address the underlying structural costs here?
Certainly. And when we're talking about the structural changes that are necessary, this is where the New York Health Act comes in. It's like, I don't know if you were like serving one up over the pitcher's plate, so to speak, like so I could hit it out of the park, but that's precisely what we're talking about. If there are absolutely some structural big picture items that we need to deal with, and I think that those are conversations that we need to have. The issue that I've always had is that with different executives, regardless of how I feel about them, is that they don't seem to want to have long-term conversations about transformations in the health system that are required to be able to stabilize it.
We have a secret healthcare commission, though, that hasn't produced its report on the future of healthcare.
Being a perfect example of what I'm talking about. It says if you have a commission that produces nothing, or a commission that produces a report that's not acted on, or
it's only been 2 years though.
We need to actually absolutely have a conversation about the fact that these are runaway costs that are not going to be able to be handled in the long term. And I do believe that the New York Health Act is absolutely essential, because the New York Health Act would go about transforming the core conceit of the entire system right now is profit. And even when we're talking about a system that most of the folks that we're talking about some folks who are in publicly financed systems, and some of them that received incentives to be able to go into the private marketplace. But in the system as a whole, keeping profit at its core doesn't serve us. It doesn't serve anybody. And keeping insurance companies at the core of making decisions about healthcare that have nothing to do with healthcare, it doesn't serve us well.
Well, with the time we have left, let's pivot to another bill you have that has to do with what I'll say is the disclosure around information related to private contractors that operate publicly subsidized health programs. What is the issue there where you feel like legislators are not getting enough information?
We call it the trade secrets bill. It's like we keep saying that. Just want to play some ASMR because I'm in the microphone. The trade secrets bill. The goal is simple in this bill. If you are a private company, a for-profit company that is contracted by the state of New York to provide a service. So therefore, you have hundreds of millions, if not billions, of our taxpayer dollars flowing through you. You don't get to tell us as a legislature, we can't give you that answer because that's a trade secret. That is, we have found over and over again that is what we see as a useful excuse by a private corporation to not really be accountable for how they're spending our money.
Is there an example of this that comes to mind in recent years?
All sorts of issues. Like we're talking about PPL.
Sure.
Weirdly enough, the single intermediary.
And the company overseeing the transition of the
Correct.
consumer-directed personal assistance program.
Correct. And they have in many instances told us, we can't share that information with you. We're asking them, like, how many folks have actually signed up? Like we were during the process, right? We were asking them all the time, how many people signed up? How many folks have you paid? And they would, at times, give us some information, but for the most part, tell us, like, we can't give you that information. And then at times when we would ask them more specific issues about how folks were paid or the medical insurance, et cetera, they would go, oh, no, that's a trade secret. How about the contracts that you have with your subcontractors? Could we look at those? I'm sorry, those are trade secrets. These are all operational aspects of how our tax money is spent. And I think that if they're gonna argue that, then they need to show us more than just put their hand up and be like, I'm sorry, can't share that with you because it's a trade secret. I think it's a useful excuse. This bill would make it necessary for them to communicate with us and to be clear. This is not about something that we would go ahead and share with reporters, however sad that might make you. There's some information that we might, but this is the type of information that we should have access to as legislators who have a responsibility for oversight for what is ultimately billions of dollars in public money. So I strongly believe that having this authority would help us better be able to do that, be able to better identify those private actors who are not acting in good faith, and again, using billions of dollars of public money to run these programs. So I believe that this bill is necessary, and I'm making it a priority this year.
Have you been rebuffed in trying to get information in the process of just submitting requests, or is this in response to like subpoenas that your committee has the ability to issue?
In requests that we've made for information.
So could you submit subpoenas, and if you did, would they be able to cite trade secrets? I'm just trying to get at whether there's a way around, this protective secrecy short of enacting a law.
I think it's a subpoena bar is a very high one, and certainly it's one that's used by, like, we do have the authority to do them. We have not. There has not been a determination as a conference. We have not reached a consensus about certain times. We've discussed it internally at times, but we've decided ultimately not to do it. But I do believe that this should not be necessary for us to seek legal action, like as in a subpoena, to say, like, we're not accusing you of anything, but you're like, you have in that computer in front of you all of this information about the people who you're serving, about the money that you're spending, and you're saying to us you cannot answer questions to us because it's a trade secret. By the way, the way the bill is structured, if you're going to argue that, you can. But you have to tell us what you mean by
Sure.
a trade secret. You don't have to flip open the car and show us exactly how the engine works, but you certainly need to show us the engine, and right now that's not what's happening. So I believe it's necessary, and I'm certainly making it a priority this year.
Well, we've been speaking with State Senate Health Committee Chair Gustavo Rivera. He is a Bronx Democrat. Senator, thank you so much for making the time.
Absolutely, good sir.
Thanks for listening to today's edition of the Capitol Press Room. For an insider take on what's happening in state government, check out our Dispatches from Planet Albany show, available wherever you get podcasts or at capitolpressroom.org.
Join us again for Capitol Press Room, a production of WCNY Connected, Syracuse.